Dear viewers, I hope you are all fine. This ultrasound video shows a case of endometrial hyperplasia along with a fibroid. You can see the scanning of the uterus and urinary bladder is also visible. You can see the endometrial thickness is increased. The endometrial hyperplasia has a cystic lace-like appearance on ultrasound. Endometrial polyp manifest as focal areas of endometrial thickening, and the stalk of the polyp may be seen if sufficient fluid is present in the endometrial cavity. Imaging the endometrium on day 5 to 10 of woman's cycle reduces variability in endometrial thickness. A transvaginal ultrasound measures the endometrium. It uses sound waves to see if the layer is average or too thick. A thick layer can indicate endometrial hyperplasia. So the doctor will take a biopsy of the endometrium cells to determine if cancer is present. Now you can see the thickness of the endometrial thickness at this point is 19.9 millimeter, which is far greater than the normal values. And now you can see a mass is also seen in the distal portion of the uterus near the posterior wall. Now this mass measures, this is the mass in the distal portion of the uterus. Now you can see both the endometrial hyperplasia and mass simultaneously in one frame. Blood flow is also visible. Endometrial hyperplasia is an abnormal proliferation of endometrial glands and stroma defined as diffused smooth thickness more than 10 millimeter. The endometrium should be measured in long axis or sagittal plane, ideally on transvaginal scanning with the whole length of the endometrial lining through to the endocervical canal in view. A transvaginal ultrasound is an imaging tool that shows the inside of the uterus and shows the doctor to see if the uterine lining is thicker than it should be. If the uterine lining is too thick, a biopsy of it will be offered to diagnose the condition. A study conducted by the Gynecological Oncology Group on biopsy-based diagnosis of atypical hyperplasia found 42.6% of concurrent endometrial carcinoma in hysterectomy specimens, the most useful tool to assess endometrium and make preliminary diagnosis in ultrasound imaging, that is ultrasound transvaginal. You can find some important information in the description of this video. Thanks for watching. Please subscribe my channel. If you do like this video, please click the like button. Thanks.